peculiarities of healthcare in Nigeria.
They don't tend to seek help easily.
Have a false sense of confidence that they know what exactly is wrong with them.
We tend to go in the direction of curative medicine more than preventative medicine.
Now, because a lot of Nigerians are knowledgeable when it comes to symptoms and signs, people tend to misdiagnose things or have a false sense of confidence that they know what exactly is wrong with them, and then they treat themselves poorly. Now, that is one peculiar healthcare challenge and then with the onset of information on the internet, people tend to want to seek medical care for themselves, and coupled with the challenges that comes with financing healthcare, people would want to go for the cheapest way of getting healthcare and then mismanage themselves.
Well, Nigerians particularly, issue of poor education. People don't seek help easily, so they tend to go to other places before they eventually, when the issues are not resolved, they eventually come back to you, the specialists, and by that time a lot of damages will have been done. And also issues of accessibility and poor, when they go to especially government-funded institutions, you have issues, there's no light somewhere, infrastructural decay. Those are the issues that are peculiar with Nigerians, and that's why they don't tend to seek help easily. They feel that a long wait, why will I go to a facility where I will have to spend more time in waiting for care and all that. And that has been, they want a quick fix, which would tend to make them go to facilities where they will not be able to get easy help.
The peculiarities of Nigerians as regards to health has not changed, and it will continue until Nigerian government change their attitude towards healthcare in Nigeria.
The healthcare peculiarities of Nigerians are we tend to go in the direction of curative medicine more than preventative medicine. Whereas it's the reverse in many developed countries of the world, and in many countries that are developing, preventative medicine is very important. It's always better not to get ill rather than looking for a cure. And part of the problem is Nigerians wait until they are really ill before they seek medical help. And that's why, again, you find a lot of medical tourism occurring from Nigeria into the other countries of the world like India or the UK, because they leave it too late, and by the time they are looking for the high-end medical care that they cannot access here, then we have to pay the kind of money that we're not paying here for the kind of health we need. Over $1 billion was moved from Nigeria to other cities, countries in the world for healthcare last year alone.
Nigerians generally have poor. Nigeria as a society generally has this attitude of poor healthcare seeking behaviour.
The health peculiarities, we have some that Nigerians will every Nigerian wants to look towards HIV, but there are some diseases that is worse. Like, for instance, hepatitis B is worse than HIV, but we don't look into that. And because of not getting enough information about that particular disease, people tend to leave hepatitis and running after HIV. So it is a big challenge for us in Nigeria. And until when people are well informed, then we know that hepatitis is a terrible disease, even sometimes worse than HIV?
The peculiarities of healthcare in Nigeria can be summed up by saying that healthcare in Nigeria is affected by the unique nature of the Nigerian environment. In Nigeria, the stress level within the society is so high, probably because of the economy and other allied problems, and that brings about a very unique challenge of hypertension, which is rising more and more within the Nigerian environment, and also belief systems, which impacts on the freedom of the doctor to treat his or her patient as he or she feels the patient deserves.